Hi, I'm Pat Gavin, President and CEO of Hunterdon Healthcare. And our tent that's in our back parking lot has created considerable interest and excitement by the community in that how prepared Hunterdon Healthcare is for the COVID pandemic. So I thought today that we would take you on a tour so you can see when we would have to, if we have to. Hopefully we never have to activate the tent. But if we have to activate the tent, what you could expect if you were inside of there and how well prepared we are, no matter what this brings with it. So as promised, we're here and we're going to take our tour of the tent. I have some really important members of my senior team here, and they have very important roles throughout this COVID-19 situation. I'll ask each one of you to introduce yourself. Come on, Chris.
Hi, I'm Christopher Hunt. I'm the Director of Safety and Security for the healthcare system and responsible for our emergency preparedness.
Lisa?
Hi, I'm Lisa Razimovich. I'm the Director of Infection Prevention and Patient Safety Officer.
And Dr. Proswimmer.
Hi, I'm Jerry Proswimmer. I am the Chief Medical Officer for Hunterdon Healthcare Partners.
Okay, so now we're going to head inside the tent. Chris, how big is the tent?
So the tent we have is 30 feet wide by 60 feet long, and we work with some of our local vendors. We work with some of our local vendors to go ahead and get the tent first, and also partnered with Hunterdon County Office of Emergency Management, Public Health Department, and Raritan Township OEM, and to get the supplies we needed to be able to open up the tent.
Great. So with no further ado, we're going to head inside here, and I'll ask Lisa and Dr. Proswimmer to kind of walk us through the tour and talk to us about not only what we're going to do inside the tent, but why it's important in the COVID situation. Obviously, the first thing we're going to do inside the tent is something that we're all becoming much better at, which is wash our hands. And with no further ado, I'll kick it off to Dr. Proswimmer and Lisa to get us a little tour and talk to us about why it's important.
Thank you, Patrick. So as patients enter the tent, they'll come here and be registered at one of our 2 registration sites. All of our encounters in the tent will be documented in our next-gen Unified Chart EMR, so they will be available across the continuum of care, just like all other encounters at Hunterdon. The patient will then come over here to our triaged nurse station. Here, the nurse will take a set of vital signs and ask a series of questions to determine whether the patient is correctly eligible for assessment here at the respiratory tent, or whether it would be more appropriate for the patient to be seen right behind us in our emergency department. In other words, patients with more severe illnesses will be taken directly to the emergency room. The patient will then be escorted here to one of our 10 examination bays, where a provider and a nurse will be ready to assist them making an assessment of their respiratory illness, ordering COVID testing if that's appropriate, and giving them advice about treatment and how to prevent spread throughout the community. We also have a series of workstations here. Workstations for our providers to do their documentation. We have a workstation for our lab runners who will be running our samples back and forth to our hospital lab for sending out to the COVID commercial labs. We have a repeat workstation here for processing the laboratory specimens that will be collected by a specially trained nurse so that we know that the specimens are both collected and handled properly. We have some specimen cold storage here as the runner is getting ready to bring that sample over to the lab. We also have a rear exit. This will connect directly over to the emergency room, and will also be a way for traffic flow to bring our patients whose visits are complete back out to the parking lot. We have emergency equipment on hand here. We have oxygen, we have an AED, we have an amp bag, very limited medication supplies, and we can call for emergency help in the tent to assist the patient if needed. And that pretty much concludes our tour.
So now I'm going to ask Lisa a question. Lisa, what would you want our staff and our medical staff and our community at large, what are the most important messages through this period that you would like to communicate to those folks?
Thank you for asking. The important steps to take right now is to make sure that we are following the basic rules of proper respiratory etiquette, that we are washing our hands frequently, that we are making sure that we are staying home always if we're sick. Right now, we have social distancing going on, which means now is not the time to be scheduling large play dates or sleepovers or going out into public places. We should be making sure that we're following the instructions that we're receiving from our health department, from Hunterdon Healthcare, to make sure that we stay safe. This includes basics, covering your coughs and sneezes, making sure again to clean your hands frequently, disinfect surfaces, and again, staying home as much as possible.
So thank you all for joining us for that tour. Please keep your family and yourself safe through this period, but please remember, if you have anything at all that you need, Hunterdon Healthcare is here to help. After this presentation, the information for our community hotline will be there. Just call in through the hotline if you want to have any questions answered or access any of our services. And I also want to take this moment to just thank our partner, Unity Bank, for their very kind commitment to Hunterdon Healthcare and continued commitment that helped to make the tent available to all of us. Thank you.